All right. So our presenters today are Karen Canclini. She is Assistant Professor of Professional Practice Nursing, board certified advanced degree in public health nursing, and she is also a trained faith community nurse. And then the other presenter is Karen Bell Morgan, Associate Dean of Campus Life in the Dean's Office with a PhD and a Master's in Public Health, and she is a certified public health educator. So Karen and Sharon, is that okay to call you that?
Absolutely.
Great. So thank you all both very much. And I think we agreed that Sharon might take the bulk of the questions, but Karen, we certainly want to hear from you. Know that you're having to do a lot of the same kind of work we're having to do of figuring out how to make spaces habitable for people. So, but to begin with, just tell us a little bit about yourself. How do you approach public health, and how did you move into this space?
I've been a nurse for 40 years, and so I've done technical work, labor and delivery, intensive care, all types of nursing, but I landed where my passion is, and that's in public health, and it's preventive medicine. So that's the model that I've been teaching for the past 12 years for Texas Christian University. I've also been a faith community nurse. I used to work under the guidance of Chris. He's about midway on my screen there, and for Rush Creek Christian Church. And so I still practice as a faith community nurse. I often practice in some of the differing faiths in our communities, the Muslim faith in particular. I work with several communities and just manage health issues. And so when Diane Hawley asked me to avail myself to this opportunity, I thought it was a wonderful time to get to speak to a bunch of pastors and how we as the faith community can respond appropriately to this situation that we're living in now.
Great, thanks so much. Karen, just a little bit, tell us what you do and kind of how you come at this.
So I have been working I just started back at TCU, but I worked there for close to 10 years. But before that, I was a public health educator for the city of Fort Worth. And so my degree is in public health and health studies. And once I left TCU about 3 years ago, I was an assistant professor at the School of Public Health at UNT Health Science Center. So prevention and education is really something that I'm very passionate about. So I'm happy to have taught some future public health educators, but essentially now my role here at TCU is to work with care and support of students, and I work with our students who are hospitalized for different reasons.
Great, thank you so much. So just help us understand what is meant by these terms we've been hearing: COVID-19, coronavirus, and novel virus. We're all using a vocabulary none of us learned in Sunday school. So can you tell us what words we're using and what we mean by them?
Sure. Coronavirus is basically the name of the particular type of virus that we're being infected with. COVID is the name that was designated to this coronavirus disease, 19, meaning it originated in the year of 2019. And that's the official name given by the WHO, the World Health Organization, so that we have a common language that everybody's talking about the same thing. And then basically it represents itself. It looks kind of like a cold and flu, kind of similar to several viruses that have been circulating, but it is distinctly different. So we have different names for it, but the designated name, COVID-19, is the one that tells us that we're talking about this pandemic virus.
Okay. And so we've got news reports that told us that a rector in Christ Church in Georgetown, Washington, D.C., tested positive for COVID-19. And now all of the members of his church who worship there for the last few weeks are on self-imposed self-quarantine for 14 days. So, with both of you having experience with church community, what makes church different than other public settings in terms of spreading this virus?
Ooh, Karen, you want to go first?
Well, I would say, my opinion is that a church is a little bit differently than other public spaces, because I feel like a church is a more intimate setting. I think that when you are a pastor at a church, when you're a congregant member at a church, oftentimes it's a lot more personable. And so that kind of that social distancing that a lot of people are talking about is not always done in a church or a faith-based setting. And so in my opinion, I think that that is one of the things that kind of distinguishes churches from other settings, because you have pastors who kind of go out into the community a little bit more. They go out to visit the sick. But then also when people are together, it's a little bit more of an intimate kind of a space.
I agree with that, Karen. And I also, you think about the Eucharist and we share, and for example, at one point, passing bread and then passing the cup, we're passing, you know, while it is considered the blood and body of Christ, it's also mixed with our spit, which is probably not a good thing to be sharing. And so we have those intimate moments in the faith community. We're singing, and these are airborne droplets, so we're sharing the love there. There's lots of things that we do in faith communities, and we touch each other, we hold hands, we pray, you know, all of those things add to the diminishing of the social distancing. So when we think about the spread of a virus, think about flu. If I'm sick, I have the opportunity to infect typically 1.5 people. With COVID, it looks more like 3.5 people. So if I'm sick, then 3.5 people are going to get sick from me, and they're going to share it with 3.5 more, and so on. To give you some perspective, measles is very, very infective. And so I have it here. If one person has measles in the room, they can infect 15 people. That's why we manage measles very tightly. We try to manage flu by giving the flu vaccine, so we reduce the amount of spread. With COVID, we don't have the vaccine, so we're spreading it at about 3.5 to 4 people per person. So you can see, and the really tricky thing with this is that we're most infectious a week before we start to show symptoms. So we're actually well. So we're going to church feeling well. I suspect the rector felt quite well, and then he showed symptoms and then was tested and then was determined to be ill. So he had already done his business inadvertently. Mm-hmm. So that is why we're saying social distancing is critical to, as you've heard, to flatten the curve, to slow down that spread of transmission. We pull in the people so that they don't have that opportunity to have exposures.
Yeah. Karen, I saw you nodding there, so I just want to make sure we repeat this. I know the answer, I think. I can be a carrier for COVID-19 and feel perfectly fine.
Yes. Exactly, that is correct, because the symptoms may not be showing yet.
Okay. And Sharon, if I heard you correctly, I'm actually more contagious at that point, even though I'm not showing symptoms. I'm more dangerous at that point.
Because you're not showing symptoms. Because once you start to show symptoms, you go, oh my gosh, I've got a cold. That could be COVID. Gotcha. But before you're showing symptoms, you feel fine. So you're out in the grocery store and you're doing your thing, and unintentionally infecting other people.
Yeah. Karen, especially as a public health educator, with each day, it feels like our protocols and our instructions change. What advice would you give those of us who don't have training in medicine and public health about communicating those out to our folk? How do we talk about this without either saying things that are inaccurate or convey the seriousness of this?
Well, that's, I think, one of the things that we kind of are trying to do a little bit differently, and at least as a university, is thinking about different ways that we can try to communicate with our community members. And so I think that as a pastor or a church leader, one of the things is just kind of getting outside of your comfort zone when it comes to communication. Sometimes we might be a little bit more old school in the way that we try to talk to our congregation, but we want to make sure that we are giving timely information. So if that is through Facebook, if that's through social media like Twitter, and then also connecting people to reliable resources on that channel. Oftentimes people really do look to kind of our faith-based leaders for information, and especially legitimate information. And so I think if you just continue to explain to people that you don't have all the answers, but the WHO and the CDC, these are really good resources. And then if, just checking their social media accounts and then retweeting or posting things to your website as they become available, and making sure that people understand that this really is kind of changing daily, and that the latest information that you have, you will share with them, but this is where you can get the most reliable information. And then also making sure that you encourage social distancing, no matter what you know or what you don't know. We definitely understand that this is a disease that can be spread very quickly through just droplets and touching your face. And so just making sure that people understand that they need to wash their hands, that they need to practice social distancing, doing all those things that we know, cover your cough, and making sure that even though we like to shake hands, that right now we're just not going to be doing that for social distancing purposes.
Great. Sharon, you and I had talked via email about resources that you would point people to. So we heard two, the WHO, the World Health Organization, and helpful to hear not just their website, but also their social media account, the CDC, Centers for Disease Control. What other sources would you give us that would be helpful in that process of getting?
One of the resources that I use is called evidenceaid.org. Evidenceaid.org. And basically what that is that is a community of librarians across the globe who are pulling data as it's coming to light. So for example, there's a discussion right now as to what was the primary source of this disease. And so an article has just been published or is going to be published soon. And believe they're linking it to the animal, the Panagonia. No, I said that wrong. Pangolin, excuse me, pangolin. It's basically like an anteater, but it is often used in herbal medicines and ancient medicines, and the meat is also eaten. So there's some suspect of that. The idea is what they're doing is they're taking, the random things that are being published and they're clearing them through the library systems and checking the evidence. And I just absolutely love that. So you can look at articles as they're coming out. They might not even be published yet, but you can see them and you can see that the librarians are filtering them and making sure that this is accurate information. And I see you're panning through it. There's the UK has a link. We have basically our librarian, Alicia Sapp, is a nursing librarian. She's the one that sent this to us. And you can get all sorts. You can see here the things that you're pulling up. They're just wonderful references, not only just for COVID, but like earthquake, Ebola. I mean, all the current things that are happening in our world, you can get the facts.
Great, thank you. And then you also shared this article with me from Visual Capitalist. And I'm not sure that this graph is going to show up on the Zoom, but I was interested in this is a familiar graph to us for many of us, and so I was wondering if you could explain, Sharon or Karen, either one, explain what are we looking at when we look at this very familiar picture now to us.
Well, basically what this picture is showing is if you put into place all the things that we're talking about, the social distancing, the stopping of some of the meetings, which would include church, some of those kinds of things where you have group gatherings, until we can get ahead of this virus, we can sort of flatten that curve, flatten the cross infection rate and help us. And the reason is if you see the long line that goes across it, the capacity of the healthcare system. My colleague, and I have a very close friend and colleague in Italy who we've been speaking almost daily, and that's their biggest issue. It's not so much that, we can't manage this disease. We can, but we just don't have the resources to manage it all at the same time, particularly since the healthcare workers are also impacted by the disease themselves. So the idea is slow it down, flatten out that curve. So do the things that we can do in the society in a reasonable way. And then, we will manage as we go, as we learn. One of the things you asked me about the difference with this is the N, the novel, is the biggest word. This is a new virus. This is something we've not dealt with before. And so we're learning every single day. And it's taking time for scientists to come up with facts and hard data. And to do that, we need to do our part by doing all the things that we can do to make that curve flatten out a little bit so that we don't tax our healthcare system so much.
Thank you. And in this graph, I looked at it, and it looked like the kind of thing we would find very helpful, because it gives the size of your gathering. So most of our stuff is down here.
Right.
But I wasn't making sense out of the math after that. I don't know if that's useful or if that's so technical that it might not be helpful.
I think it was rather technical. I think the point they were trying to make, though, is the bigger the group, the greater the chance. So even the small, the number still doesn't change. One infected person is going to infect 3, basically 3 to 4. So it doesn't matter whether you're at a wedding ceremony with 100 people or if you're at a big concert, it's just going to be exponentially larger.
Yeah, thanks. Karen, you were nodding along. Is there things you want to say there?
Oh, I was just echoing what Sharon was saying. I mean, I think just the simplest message is, just making sure that we're doing our part and trying to be preventative and trying to flatten that curve, and making sure that we do understand, a lot of times it's very hard for us to not get together with our social or our faith groups, but just understanding that it's more important to try to think of a different way of trying to still have that type of gathering, but in a way that we're able to practice good public health prevention. And then the other source that I just thought about is, of course, your local county health department, because as we've been talking about, the recommendations as far as how many people can be out in events, it changes all the time.
Yeah. So we've got a lot of pastors on the line. We all serve churches where everybody is angelic and never stubborn, but every now and then we encounter the very stubborn member who just doesn't want to believe any of what we're saying. Have you found some strategies as you've dealt with the people in the TCU community that maybe breaks through the stubbornness, or that clarifies what's at stake?
I would say that, we've had our handful of people who, especially those vulnerable populations, making sure that they understand that right now, just working on campus is just not the appropriate thing to do, mainly for their own health. And so we've had some who have been very willingly and graciously been able to work from home. And then, of course, we have some who, might be a little bit more stubborn and feel like, nope, they're fine. They'll do all the preventative things. But I think when you just kind of essentially just say, this is really just the most responsible way to try to do your part in preventing yourself from being sick. Also sharing, we really need that person. They might be a valuable asset. And if they get sick, it just really does, it really not only hurts them, but it hurts the organization as a whole. So just really trying to make people understand that it's really all about prevention. Right now, we might be seeming like we're overreacting, but our goal is just to try to do our part so that we can help the greater community.
Thanks. So none of us have crystal balls. Any sense of what our timeline is going to look like?
My guess is, if we're going by the current data, we're at a 2-month window before you start to see some relief. We are still, in the United States, we are still adding cases. The Italians are starting to flatten out a little bit. You could see in that graph where Asia has already, starting to flatten their curve, and it's coming down. Now the United States has more than, so right now we're in an uptick. And so that means we really need to pay attention. One of the things I wanted to share with everybody is I foolishly went to Costco to buy, of all things, bulk cheese for an event. That's not going to happen. But me and 6,000 other people, and this woman said, oh my gosh, what should we do? And I said, we're doing exactly the wrong thing, because we were all stuck in Costco in a line. We need to avoid. So if you see that you're going into a situation where there's a lot of traffic, like close contact traffic,
walk out,
go home, go back home. Cheese is not that important. And I was with another person, so I personally made that decision in my mind, but my colleague didn't. And so that's when I said, I've got to negotiate these things with the people I travel with, because so I think those are the kinds of conversations we need to have. We need to be aware of the vulnerable populations. Our shut-ins, are they getting food? We need to check and make sure that that's the case. Our children, are they safe? We need to make sure that that is the case, because some places, you know, some families might not be able to have parents at home and children at home.
Mhm.
So, you know, we need to, as church community members, we need to be aware of what's happening around us and see how we can come together as a community to help the families that can't help themselves. A lot of people are going to be put in dire positions because they're losing work and they're losing wages if they live on their paycheck month to month or week to week. So those are the things that concern me, is how do we help those? Well, like we're relatively fine. How do we help those who are not? And therefore they're at risk as well, financially, emotionally, spiritually, you know, so.
Sure. Thank you all very much. I will open it up now for conversation and questions. You can unmute yourself if you're on this call. You should be able to, and otherwise you can also ask questions in the chat feature. Karen Morgan, Sharon Canclini, thank you very much. Robert is asking us to post the websites in the chat. I will do that, Robert. Any other questions? What other questions do you all have that you would like to ask?
Andy and Karen and Sharon, I wonder if I can check an observation of mine looking at the bell curves. One thing I noticed particularly today is that the timeline is still pretty much the same. The key is that capability of the medical system to handle it. So even if you flatten the curve, you're still talking about the same period of time, basically, that this is going to last. Is that correct?
It seems to be that way right now. Because of what the disease does, it puts people on ventilators. It affects the respiratory system and the at-risk population. And if you look at the American population right now, a lot of us are 60 and above. That puts us at the at-risk population. So I do believe it's going to be the same. You're right. One bell curve does this and one goes like this. It's the same time frame because we're working with a virus that has a particular life. There's some thought that it will shorten maybe when the weather changes, but no one wants to bet on that.
Mm-hmm.
You know, we're all going to say go slow and steady and don't push it because we can always have a spike because it's so contagious.
Right.
Thanks, David.
Thank you.
Mm-hmm.
Other questions? That was good. That's helpful. John is asking, in Albuquerque, local stores are opening Monday, Wednesday, and Friday for senior-only time of shopping, first thing in the morning when everything is sanitized or best sanitized. So some of those kinds of practices seem to be providing some help for our most vulnerable populations. I wonder if a church particularly wanted to say, call to its elderly members or its vulnerable members and offer to pick up groceries, what kinds of precautions, Karen, would we want to make sure that those folks take as they either both shop for and then deliver those kinds of items?
I think the biggest thing is more so just doing that as internal monitoring of yourself, just making sure that if you are feeling sick, you are not the one to go get those groceries for that senior in your church. Because essentially then when you go to visit the senior member, you are now exposing them potentially. So I would definitely say that, you know, oh, was there a question? Oh, no. Okay, so I was going to say, so for those who might be the ones delivering that type of meal, just making sure that they, you know, check their temperature if they need to, wash their hands, make sure that they're practicing social distancing when they do deliver the food to, or whatever the item may be, to that senior member. Sharon, are there certain items that you would recommend? Because as far as things picking up, I know people are going crazy over toilet paper, but I would think it would be more so things to help with like those respiratory issues that may come up or whatnot.
Right. Well, I had a couple of thoughts. One is American Red Cross National Nurse. I don't accept home cooked food when I work a shelter. And the reason is I can't control who puts their fingers in the food to taste it. And I can't control the infection properties. So I don't recommend that we do food trains. I don't think that's a great idea. I think what we should do is Grocery stores, you can mail order groceries from the grocery stores and have them deliver. And if you have somebody that's sick in your household, they can deliver at the patio. And then you can go out and pick it up and bring it in the house. So you're not exposing either the healthcare or the patient or the delivery person. So I think those kinds of things are useful in this day and age. I like the fact that you can do drive-through if you want a meal prepared, and some of the restaurants are doing drive-through. That's another good option. As far as cleaning goes, cleaning is really simple. Bleach, 1 cup of bleach to 5 cups of water. Simple, cheap, wipe your surfaces down. And then as public health nurses, and Karen probably knows this, is our mantra is the dying is in the drying. So when you wipe something down with a bleach wash, you just let it air dry. You don't fan your hands. You just let them air dry, and that's the time when the virus itself is decomposed from the bleach. You can also use rubbing alcohol and wipe down handles and doors and light switches and things of that nature. So there's lots of things that we can physically do that makes us feel more secure. I would buy Kleenex tissues so people can cover their mouths if they, have a need to sneeze or a drippy nose. We're moving into allergy season, so we won't be able to determine what is what. So we just have to assume everything is somewhat level of nasty. And so we just handle everything. It's like universal precautions. So we just handle everything as if it's infected, being very, very careful and washing our hands in between frequently. Lotion might be a nice thing to get as well because our hands are starting to feel a little rough. And then I would get, as far as food items go, I would get tuna, pasta, things that can be prepared in the home, that's, and the fresh fruits and vegetables if possible, those I would have delivered. Frozen foods. So really, the run on toilet paper, I don't understand that. But everybody was trying to do something to make them feel better. I know a lot of people have a lot of extra water. I don't think it's an issue. Yeah. I think our tap water will be just fine. And if it's not, you can always boil it. It's pretty simple. So I don't let your congregation panic, but they just have to be realistic. Sure. That's my recommendation. Just be realistic.
I have a question from Pastor Kay about travel, especially in the state of Texas. So he's not worried about international travel, which will be governed. But just, so the advice I'd been giving, and you can tell me I'm wrong and that won't embarrass me, but I've been saying if the county has had an outbreak, don't go to that county. But what would you advise about traveling from different parts of the state?
This is not the season to travel, in my opinion. In my opinion, it's in 50 states right now. It is across the globe. This is a pandemic. This is not a joke. It is real. And so now is the time you have your staycation. You just do. Yeah. You agree?
Yes. It's been advised not to do any leisure travel. And I know a lot of corporations are canceling all work-related travel as well.
Sharon and Karen, a real quick question. Based on what you just said about food, and I've thought this really for about 10 years, it sounds like when we are able to get together and be church in person again, that we're going to have to rethink fellowship dinners and those kinds of things from the ground up. But I wanted to ask you if it's hypothetically, if it's 2 months out before we realistically can anticipate beginning to drop in our number of cases. How far out is it before you would anticipate the cases would be low enough that we would have life back to normal? I mean, is that a 6 months, 9 months?
That is the question. I don't know. What I suspect is that people will eventually start dribbling out until eventually it just kind of goes back.
Yeah.
But my colleagues in Italy, Venice is shut down, Florence is shut down, Milan is shut down. I mean, everybody that I know in Europe, and they're well into this. So my recommendation would be not to anticipate, and I've got a son that's planning a wedding in August, and his little bride is convinced it's all going to be okay by August. I don't know, but we'll find out. So
And I think it's important to understand the unintended consequences of everything that has happened, with everything kind of shutting down for a little bit or pausing. And so because of those unintended consequences, I think that, you know, things are going to be shaky for a little while, because we still have to think about all of our students who are trying to figure out how to finish college. Me as a parent of a young kid or young kids, I'm still trying to figure out, like, how am I going to work from home plus do their work from school? So I think that, you know, we are all trying to kind of figure everything out as it goes. And so I think that that also is something to be mindful of. People are anxious right now. And so trying to provide as much help and support as you can. They may not name it, but it may be that they're starting to feel the symptoms and they haven't even been outside or something, but people are starting to feel anxious about what's happening and how are they going to survive these next couple weeks, especially with those with kids. So I think that that's also something to be pretty mindful of as well. So it's hard to say when things might get back to somewhat of a normalcy.
Sure.
Yeah, I think our normal will be a new normal. And so in my classroom, I teach a wellness component. And so I've just reframed it to thriving instead of surviving. Oh, you'll survive this. I changed the language to, we're going to thrive in this situation. This is the first time in probably many, many, many years that we've had a chance to sit down and read a book undisturbed. And, you know, my friend in Venice said for the first time he can look in the canal and actually see fish in the canal. And he's lived there all his life. Wow. And he, as an adult, for the first time is seeing fish in the canals in Venice. The idea is we need to reappreciate what God has given to us. This is a stop, pause, an enforced one, maybe not as pleasant as we want it to be, but it's a stop, pause, and an opportunity to reconnect with our families, our children, our communities in different ways than we have in the past. So that's my approach, is I'm just reframing, trying something new.
Thank you. Thank you. That's helpful.
So I have a quick question, and this is Peggy Edge, and I have a quick question, and I'm thinking that in light of narrative therapy, that we need to be more constructive, as you just said, in the way that we're approaching life, and thinking of it as how are we going to thrive now that our circumstances are a little bit different. What's going to work for us, and what can we celebrate, and how are we going to find reasons to rejoice over things that are happening, rather than to look at them from the glasses only half full. So do you have a word as someone in public health, either one of you, about how we encourage our society to look you know, at this from a constructive point of view?
Go ahead, Karen.
Well, okay, I was like, who's going first? So I was going to say, I think it really kind of starts with your community first, and then hopefully it will start, you know, bleeding out into others. But I think that, you know, as a faith-based group, it's important to kind of be the lead in that. For instance, I have a friend who's a youth minister, and what he's choosing to do is he'll have dinners with some of his youth. And so they just do it through FaceTime. You could do it through Zoom, and his family sits down at dinner and just watches the other family on TV, and they have a conversation. So I think that this is an opportunity to be creative and to kind of set some new ideas of how we reach the greater amount of people. And then just showing them, I think a lot of times in order to kind of set that tone, it's a lot through kind of example and leading by that example. And I think that by having those opportunities and finding those ways to help your neighbor, to communicate and to congregate with each other in just a different way, will be one of those ways that we can say, you know what, this is different, but we are still thriving, and we still are connecting, and we still are just finding different opportunities to make sure that we're supporting each other and celebrate those.
Yeah.
And my colleague in Italy, you know, the Italians are very, they're very into music. And so they do community singing. They bust open their windows. Wow. And they all, you know, they had set a time, and they're all singing the same song at the same time. And so you can hear the music. And I think it is just a wonderful idea. Maybe we adopt a particular hymn and, you know, make that like our church's hymn, and we're going to master this one. And then eventually we'll get together and we'll sing it. But in the meantime, we're going to do our own parts, I guess.
Wow.
And it's just a thought.
Yeah.
Thank you.
Beautiful thought. Thank you.
I think there's a really good question on here that I think would be really good for Sharon. It's from Linda Barnett.
Yes, thank
About
you.
as a caretaker of a disabled husband with both lung and heart disease, we were self-quarantined. Do I need to be wearing a mask when going through a drive-through?
Not unless you're sick. You have to understand the theory of the mask. The mask is if you're sick, you're going to protect the droplets from going out of your lungs into someone else's. So that's the value of the mask. You're not going to prevent, because as soon as those droplets get on your mask and you inhale in, no, it doesn't work that way. And plus we handle that mask all the time.
Mm-hmm.
So what happens is that it becomes more of an infectious agent than it does of a preventive method. So I don't recommend it. If your husband is sick and you want to protect him, yes, but I personally wouldn't take him out even that far. I would keep him in the environment where he's safe, and I would do drive-through that way. I know it's burdensome, but.
Would you say the same thing about gloves?
Well, gloves are an interesting thing. If you're picking up dirty things, you want gloves, but the gloves really aren't going to prevent you from sharing anything else, because the minute you cough, sneeze, touch it, it's on your glove, which means it's as good as on your hand. And the thing is that people put on gloves and they think that they're protected, and then they touch everything under the sun. So no. So my recommendation is use your clean hands and wash them frequently.
Yeah.
That's why God gave us this lovely skin. And it's washable. And our gloves are not. In fact, our gloves are actually porous, but don't tell anybody we know that. It's true.
Yeah.
So.
Richard's asking, is there a website that's going to show us the county by county progression? He's out in West Texas, God's country, and so it has been protected from this infection, but it's starting to move that way. Is there a way for us to see how that's spreading?
I don't know the answer to that. I would probably go to Tarrant County Public Health, because the county health departments are linked together. And so and then the state health department would also be the next. I would go county, then state, and see if you can find it that way.
So Richard, I don't know.
Public health department is listing things by county. So Texas may do the same on the Texas Public Health Department website.
New Mexico is? Tiffany's up in Santa Fe, New Mexico. You're saying that you're...
Yeah, on New Mexico Department of Public Health, whenever they have new presumptive cases, they do list what county they're in. Not that that's necessarily that relevant, since we should all be staying home anyway, but yeah, they are sharing where they are. So
thanks. Good. Any more questions? Karen and Sharon, thank you so much for your time. I don't want this to end. I guess maybe I want to say, could y'all do this again in maybe 3 weeks? But thank you so much for what you've done. Can you tell us both ways we might be in prayer for you during this time? Karen, how can we be praying for you?
I think it's, I tend to think about, I think single parents out there who are just trying to, manage with their kids and work. I think I always just kind of think about those who might not be as fortunate to have, a salary job. So I think that for me, prayer to help with anxiety, to help with those who are struggling, and to help with those just trying to, figure out how they're going to kind of make it through these next few weeks, I think would be very helpful. And then also just good prayer for direction, insight, and calmness would be greatly appreciated.
Thank you.
That's
Thank
wonderful.
you.
Karen.
Ways we can be in prayer for you?
Well, I have the wonderful task of getting senior 2 nursing students through nursing school with no clinicals.
Oh!
So I am learning right now. I'm online. I'm putting all of my courses back up online, which I've not done. And so I'm learning the skill set as we go. So I'm flying. I'm building the airplane as it's in the air. But so not so much for me, but for my young students who are very, very, they're going to miss graduation, pinning, all of the honor ceremonies, all the hard work that they've put through to get to this point in their lives is going to be put on hold. And I suspect the university will do something for them, but it certainly won't be on the day they had dreamed of graduating. So I'm working with graduating college students. Just be mindful that this is their little fragile hearts right now are right in the middle of all of this. And
It
so that I do a good job of mentoring and coaching and shepherding them as we move forward, because they're going to be our frontline nurses.
Absolutely.
Yeah.
Thanks.
And I've got 2 babies coming, so pray for my 2 babies.
Yeah. Wow. Wow.
But they are well.
Congratulations. And
Thank you.
for them. Peggy Edge, can I get you to pray for us and pray for these concerns that Karen and Sharon have raised for us?
Absolutely. Let's pray. Strong and loving God, we give you thanks for Sharon and Karen and the work that they do to help us all understand what it means to live together in larger community with our health concerns on the front side of our mindfulness. We give you thanks for the wisdom that's been shared, and I ask your blessings on all who have been present through internet connections, that we may take a deep breath and know that you will always be with us, and that this is not going to be over tomorrow, but that there's no reason to be afraid, for we have reason to hope and to act in ways that we can bring about wholeness to our society again. Bless those who are suffering. Be with those who are lonely, those who feel isolated, and help us to reach out and to touch them virtually through many different ways that we can to help bring about healing and wholeness. It's in Jesus' name that we pray. Amen.
Amen.
Thank you all so much.
Thank you.
Thank you. Have a good
Thank
day.
you. Yes,
Chris Wilson,
thank you
good
so
to
much.
see you.